You're in for another drug dealing basics video. Today, patience. Now that we got that out of our system, my name's Akash Inti, your favorite biotech research analyst. Today, we're talking about healthcare stakeholder groups at a high level with a specific focus on patients. We'll cover why are patients important in healthcare as an industry. What is a patient? What's the definition of a patient? And who are these people? And lastly, how do patients engage with other stakeholder groups within the healthcare industry? Awesome. With that, so why are patients important in the overall landscape of healthcare? Well, patients are a crucial stakeholder within healthcare in and of itself because these are the people who healthcare is delivered to. In other words, patients serve a critical role in the healthcare industry, most notably as end consumers of any products or services that are rendered within healthcare. Now, with that, we'll get into a bit of, we've kind of covered at a high level what are patients. According to the definition page that I found on Wikipedia, a patient is anyone who receives any type of healthcare or service, and oftentimes they're ill. They are needing some type of medical treatment. Typically, that treatment is provided by a physician, a nurse, a psychologist, a dentist, could be a veterinarian as well. These are, so at a high level, we're getting a better sense that patients are not only, well, first off, from that definition, patients are not only humans, they can also be animals, like livestock, dogs, cats, so on and so forth. But with that, it's also starting to unveil or uncover that patients are the ones receiving healthcare services and healthcare in general. So before we continue, I thought this was really, really cool of a definition. Patience, patiens, is the Latin derivative, and patiens means one who suffers. So the idea being that a patient is a person who suffers in any way, shape, or form. Really just a cool little tidbit, if you will. Now getting into how do patients engage with all of the other pieces of the stakeholder groups within healthcare. Now, we've talked about a couple of the other stakeholder groups in prior videos, so I highly recommend you guys check those out to get at least a better semblance of some of the different stakeholder groups. Again, this is just cursory. It's like a very high-level look, so it's not in detail talking about every single little relationship that goes on, but I'm covering really the high-level ones and the ones that are probably most important for anyone to know. We'll start with the patient-doctor relationship, or the patient-provider relationship. Doctor-provider is synonymous in this particular example. Now, it's interesting because patients obviously go to doctors for healthcare in and of itself, or some type of provider. The relationship there is that patient, if I'm, in this example, let's say I'm the patient, and let's say you're the doctor or the provider, I would come to you asking for some type of healthcare service or some type of product, healthcare product, that needs to be administered by the doctor. And I would come to your office, whether it be in a hospital, it could be in a doctor's office, so on and so forth. And I would come to you and I would pay you money, and in return you would give me healthcare services or healthcare products in this particular example. Now, so that's one type of relationship that exists, the patient-provider relationship. Another relationship that's really critical and key is the patient and insurer relationship, and we in future videos will insurers could also be going by the name of managed care organization, but again, the concept here is that the insurer is a third party from the patient provider relationship that is also involved in this circle, if you will, or in this web. Now, as a patient, not only am I paying you some money as a copay if you're the provider, but I'm also paying my insurance company. And the idea being that my insurance company will end up paying the bulk of the costs to the provider, rather than me, because usually provider costs, as I'm sure many of you are well aware, healthcare costs are pretty expensive. And so rather than me having to shell out a couple $1,000 or a couple $100 just like that, all in one sitting, I pay this healthcare insurance company so that when that time comes, they end up negotiating with the doctor itself in terms of prices, so that prices come up or usually come down from the doctor's end. The doctor will bill at some rate. the provider will, or the insurance company will say, well, we're going to only pay at this rate. And the doctor's like, okay, fine. So in some senses, they help me negotiate because they're a larger organization and they have more bargaining power. But not only that, they're also able to help me in the sense of pay for large healthcare services in a bundle, whereas most patients are not necessarily able to do that of their own just because not many people are sitting on huge sums of money. Now, so those are three critical pieces again to this whole. So there's a patient, you've got the provider, you've got the doctor. Now there's usually also a pharmacy as well. We've talked about pharmacies in a prior video, and pharmacy, the relationship from a patient to a pharmacy would be that as a patient, the doctor's like, okay, well, you need to have some, let's say it's an antibiotic that I need to get. Maybe I had like some type of stomach bug. Doctor writes me a script for an antibiotic. Now I go over to the pharmacy, my local CVS. As I get to my CVS, I give them the script that the doctor provided, and they look at the scripts, they make sure that everything checks out, and then they, at the pharmacy, will prepare the actual medicine and then give it to me. So I pay them money, and in return, they give me medicine. So it's usually like I want to say adjunct. It's like something that you add on to what the service is. So let's say I needed to go to you for a surgery, and part of the surgery, you wanted to make sure that you didn't get it. There wasn't any bacteria or anything in the air. So you're like, we're gonna put you on some antibiotics just to make sure that nothing infects you. So I'm like, okay, cool. So I go over to my pharmacy, go to the pharmacy, I talk to the pharmacist, and like, hey, what's up, Mr. CVS man? I need to talk to you today. I need some antibiotics because I just got a really interesting surgery on my ankle. Yeah. We go back and forth. He gives me the medicine. I take the medicine. Bam. So at a high level, those are the most, I'd say, intimately connected pieces to a patient or stakeholders to a patient. Now, there's others that we haven't talked about here. These could include pharmacy benefit managers. This includes the biotech and pharmaceutical or biopharmaceutical manufacturer. We could also look at other stakeholder groups as well, patient advocacy groups, and so on and so forth. I'll lastly only cover patient advocacy groups because I think this is a really, really key topic, and it's something that I have a particular passion in. Now, patient advocacy groups usually work in the way that they're larger groups of patients who team up together, and you know what? We're actually going to save this for another video because I would not do this justice if I were to bundle up patient advocacy group in like the next 2 minutes. So I'm going to save a whole video for patient advocacy groups because it's something of huge, huge passion to me. With that, I'll leave you guys with this. If you liked this video, like, comment, subscribe, get notifications, share with others. That would be awesome. Lastly, if you guys have any questions or comments, let me know. I'm more than happy to cover particular topics of interest to you guys, as I've been studying healthcare more and more over the past few years now. It's really a passion of mine just to be able to convey some of the information that I learn and really boil it down in ways that are reasonably friendly to general population or to anyone, right? I like to think that the way I'm communicating to you is just the way that, okay, this is general healthcare. I'm getting a better sense of like what is actually going on in healthcare because it can be really complicated. So with that, again, like, comment, subscribe, share with anyone who may find this valuable, and I leave you on that. Remember, keep up, thrive, and stay sexy.